be washing my hands before I see my patient. Hi, my name is Angela. I'm going to be your nurse today. May I look at your armband and you tell me your name and date of birth?
Miliana Meadows, 10/17/84.
Okay. I'd like to do an abdominal assessment on you. Are you okay with that?
Yes.
I'm going to pull the sheet down some, and then I need to lift your shirt. Are you okay with that as well?
Yes.
Okay. So we'll be looking at two angles on her abdomen, and what we'll be looking for is aortic pulsation or peristalsis. You can detect aortic pulsation on her, but I do not see peristalsis. And from there, we'll look at the skin to see if there's any discoloration, to see if there's any lesions or scars. Also, to note her umbilicus, it is inverted. There is no lesion there nor redness. It is midline to the 4 quadrants. And then we'll also be looking for any vein distension or dilation. If that were present, which it is not on her, it would be consideration for either liver disease or pulmonary hypertension. After that, I'm going to check for a hernia. I'm going to ask her to raise her head. We could do that or a Valsalva maneuver. If you can raise your head for me, and we'll check that. I'll just gently touch around the umbilical area, and there's no hernia noted there. Also, we'll check for inguinal hernias, and that will be at her groin area. We'll check the right first, and there's none there. And to the left, and none there. After that, you can put your head back down. And then we'll auscultate with the diaphragm of the stethoscope. And we'll start at the right lower quadrant and go clockwise. Vowel sounds are present in the right lower quadrant. Check in the right upper quadrant. Vowel sounds present as well. Move into the left upper quadrant. Vowel sounds also noted there. And then to the left lower quadrant. Vowel sounds noted there as well. If she did not have vowel sounds for greater than 5 minutes, then we would call the physician. And next, what we want to do is take the bell of the stethoscope and check for bruits. We'll check the aorta, midway and midline from the xiphoid to the umbilicus. We'll check for a bruit. If there were a bruit present, it would not be normal, and it would have a turbulent blood flow sound. She has none. We'll move over to the right renal artery, which also lies midline, lies to the right and left between the xiphoid and the umbilicus. No bruit noted. Moving to the left, and no bruit noted. We'll move to the iliac artery, going to the right first. No bruit noted. And to the left. No bruit noted. And that lies between the umbilicus and the pubis. And last, we'll go to the femoral artery, which lies the groin area to the right. No bruit noted. And to the left. And no bruit noted. Once we've done that, we will want to check for percussion. And we'll again start at the right lower quadrant and working our way clockwise. It should make a tympanic sound, and hers does. Move into the right upper quadrant, and then from there to the left upper quadrant, and then finally to the lower abdominal quadrant. It sounds normal. Next, we will palpate, and I'm going to have you raise your knees. And are you comfortable?
Mm-hmm.
Okay, so we're going to go again from the right lower quadrant in a circular motion. And we'll do that several times in each quadrant, checking her face for any distress, for tenderness or pain. And what we're looking for is any rigidity or tumors. And then we're going to go to the right upper quadrant and note there as well if there are any rigidity or masses. And then moving over to the left, noting if there's any rigidity or mass. And then finally to the lower left quadrant. And there are no masses nor rigidity. You can lower your legs for me and then sit up. And now we're going to check bilaterally her kidneys. I'm going to put my hand flat against her right kidney area with my fist position and tapping. Is there any tenderness noted?
No.
And on the left as well. Do you note any tenderness?
No.
Okay. And that concludes the abdominal assessment. Thank you.